By the way, when the committee came up with a way to apply that amendment and to say all committees and members of Congress must be in the plan, we were told that was not germane. I was the guy that came up with the idea of applying it to all federal employees, including members of Congress, and that was germane. So it was one of the fights I've been in back there on behalf of you. Now there was a second question, I'm sorry. All right, this is an outrage. What she's talking about is the report. It is an outrage, it is probably illegal, and I just have one question. Where is the ACLU? Lots of Americans are very frustrated right now saying, what can I do? Go home today, Google the ACLU, send them an email and ask why they didn't condemn this the minute it came out as a public matter, and why there isn't a criminal investigation by the Justice Department of the White House for asking Americans to snitch on other Americans.
Thank you for coming, and I really appreciate it. And, you know, there's a consensus out there that 70% of the American people are happy with their health care. So, if it ain't broke, why are we doing this? Number one. Number two, this is a total takeover of our government. This will be the end of the private sector if they hit cap and trade also. I watch you on C-SPAN. I see you having to deal with the progressives. I know your fight. I also wanted to tell you that since we have been classified as mobs and stuff, I want to know if you're going to take care of the Apollo group and John Podesta that orders the Acorn and SEIU out. One more thing. I'm very concerned over the Federal Reserve. I know we're on health care, but Ben Bernanke just spent another $1 trillion sending it out of our country. Our money is gone, and there is no accountability. He should be fired and held for treason.
Let me just make some quick comments so we get to the next question. Number one, you happen to know how I feel about the SEIU. You turn on your television, you'll see they're running ads against me on health care. Number two, Federal Reserve, I've signed on to Ron Paul's bill to require an audit. Number three, returning to health care, I want to reiterate the point that this woman just made. I've served in Congress 15 years. Some people would say that's too long. Some people would say it's not long enough. Let me tell you that there has never been an issue. There has never been an issue anywhere near as important that has come before the United States Congress in my tenure there. Probably not an issue as important as this in the last 30 years. And so there has never been an issue of this level of importance. There's never been an issue this significant in the 15 years I've been there, or probably in the last 30 or 50 years. The young lady said, if we pass this, it's the end of America's free market economy, and it's the beginning of our adoption of a full-on European socialist economy. You have to speak out. You just have to be polite, you have to restrain your temper, but you have to speak out, because it's got to stop, and it's got to stop with this bill. We have the youngest person here to ask a question.
Sure. Doing my part to lower the median age.
And raise the IQ.
Okay, so as a young person, I appreciate your opposition to forms of government-run healthcare. And I was just wondering what bills you would either support or introduce in Congress to abolish current socialist healthcare programs such as Medicare and Medicaid.
Well, thank you. Oh, sure. I'm sorry. I assumed you heard it at the back. My apologies. The question is, what bills have I introduced, or what bills would I introduce or support to deal with essentially socialism already existing in medical programs in the United States. And I presume the reference was to government programs that already provide health care, which you could begin with Medicaid, S-CHIP, and perhaps Medicare. The answer is we should be giving every American choice. On health care, we should not put any American into a government program. What we want to do is encourage a society in which people embrace individual responsibility and individual opportunity. Not just successful people, but everyone. Why don't we do away with Medicaid and say to the poor, we're going to give you a stipend and you can go out and buy a health care plan. And you're in charge. And you get to buy a plan. Here's a great example. You all know that we expanded S-CHIP earlier, not in this Congress, but in last Congress, once the Democrats took control, or once the majority switched. In that debate, many of my colleagues said, let's give people a choice, just a simple choice. You can enroll your child in the S-CHIP program, or you can take what's called premium support, the same amount of money, or maybe it would be more, slightly less, and keep your child in a private health care plan. The reason we want to do that was to give people choice, because that's what America's about, but also because if you suck a lot of people, a lot of kids in the S-CHIP program, out of private health care and move them onto a government program, what happens to private health care? It collapses and the rates go up for everybody else. So we asked the majority party, let us have what's called premium support. It got voted down. The reality is, Medicare is the hot topic. Why is Medicare a government-run program? Why not your employer assists with your health care during your working life, and to the extent that government funds health care for the elderly, once you reach a certain age, why not have the government financially assist the elderly, but let them make choices? Once again, why put everybody in a government program? So I think that answers what I would do. Yes, sir.
Hello, everybody. I'm Dr. Neil Steinhoff. Well, thanks for being here today.
You bet.
My name is Dr. Neil Steinhoff, and I'd like to thank everybody for being responsible here today and peaceable. And thanks for being here, Congressman Shadegg. You may be thinking to yourself, well, what is Dr. Steinhoff going to get from this thing? Nothing. I'm retired. Okay? But I have a great deal to lose from this thing. My medical care. Where is the best medical care in the world today? Here. I know medical care in Europe. I know medical care in China. I know medical care around the world. We have the best care in the world, without a question. And where do people come when they're sick and want great care? You got it. I know medical care here in Phoenix as well. The best medical care at the good medical centers, okay? The Samaritans, the St. Joe's, and so forth. Where's the worst medical care in Phoenix? At the VA, baby. There's a one-payer system for you. I worked at the VA in Ann Arbor, Michigan, went to medical school. I worked at the VA hospital in St. Louis, where I went to residency. Worked at the VA here. If you want a one-payer system, baby, you're gonna get it. You won't like it.
I think there's a question working here.
I'll just give you one anecdote, and then leave it up to Congressman Shadegg, of what a friend of mine who did anesthesia for me, Roland Cooch, had his father-in-law got sick in Scotland, and his classmate took care of his father-in-law, and he dealt chest pain, and he needed I used to be a cardiac surgeon. He needed a heart workup. So in January, he was referred for a treadmill. In May, he had his treadmill. He was recommended for an angiogram. And in July, he had an angiogram, or he almost had an angiogram. He died the day before the angiogram. England, Scotland. If you want a socialized medical care, that's what you're going to get.
There we go. Go ahead.
Okay, I'd like to start with letting everyone here know, thank you for being here, but I am in